My name, for those who don't know me, is Dr. Ali Shahbaz. I am a double board certified dermatologist. I practice here in Austin, Texas at Westlake Dermatology in Lamar Central, so Central Austin. Today's topic is going to be about smart body lipo, particularly the pros, cons, the rundown of who's a great candidate. I'm also going to highlight some great safety protocols, some recovery expectations, talk about some realistic results, and we're going to have a live Q&A as well. And you're welcome to always ask questions in the chat box like I mentioned. All right, so why does this topic matter now? Well, it's interesting that this is becoming more and more of a common conversation with a lot of patients of mine. And the reason why this is because it's the number one surgical procedure still as in contemporary times right now in aesthetic surgery. It remains the most popular cosmetic procedure according to the 2024 ASPS report. And there's a growing demand for targeted body contouring solutions for patients of all ages. The nice thing about today is we're going to talk about the targeted approach. So today, patients seek precise body contouring for stubborn areas rather than kind of a crash diet, weight loss approaches that often fail in long term when you do look at these patients over a longitudinal study. We also want safety. So advanced tumescent techniques, they prioritize safety with faster recovery times and ultimately improved outcomes compared to traditional methods. How does the technology work? When you think about smart body, it's often smart body lipo. It's kind of also often used as in terms of a verb rather than actually a noun. And the reason why is because we've become so colloquially used to the word smart body lipo. But I'm going to break it down for you in terms of what this actually means and the science behind the procedure. So the first step is the tumescent liposuction, and that involves injecting a solution of local anesthetic with dilute epinephrine to minimize bleeding and enable precise fat removal with enhanced safety. And the second part, which is the smart body part, is often called the laser aspect. And that's when the laser assistance adds controlled laser energy and it helps melt fat cells while promoting collagen remodeling for potential mild skin tightening. And that key word is really important, the mild skin tightening. Often we think about lasers and we think about drastic skin tightening. That's not what smart body lipo does. Smart body lipo is great for a patient that has persistent fat in a specific pocket in their body that isn't responding to diet and exercise, but now they need that fat not only removed, but that skin that was covering that fat pocket to also be tightened. And this is great because both of these modalities together give you a significant advantage over traditional suction-only methods. What's the result? Well, the result is a sophisticated body contouring, not weight loss. And the distinction is crucial because it allows you all as patients and potential patients interested in smart body to set proper expectations and allow this to be an adjunct to achieving your optimal outcomes. Now, who makes the ideal candidate? And I get this question all the time because some patients will ask me, well, am I the ideal candidate? And I'll kind of break it down to three main prongs. So the first prong is someone who is near their goal weight. So that means you're within 10 to 20 pounds of your target weight. So with stubborn, pinchable, subcutaneous fat, and that's resistant to diet and exercise. It's important to note that visceral or internal fat is not addressed through liposuction. So we often will see someone that will say, well, this is a very firm, hard pocket of, my abdomen or, my lower abdomen. And that's often visceral fat, which is structural and it's used to support your internal body's heat to thermal regulation. So that's not the type of fat that is going to be amenable to liposuction. The fat that's stubborn, that's pinchable, that's just beneath the skin, that's the usual fat that we can usually suck out when we do smart body lipo. Now, the second part is usually the skin quality. So when I'm assessing a patient, I'm looking at their overall weight, body composition, but I'm also looking at the skin quality. And you need to have adequate skin elasticity with only mild laxity. The reason why that's the case is because those patients will allow the laser to retract the skin, almost like a shrink wrap in those areas where I've sucked out the fat. Through a cannula or through pressure-assisted liposuction. And when I'm able to see that they have elasticity, the result in overall cosmesis in those areas will be much, much better and superior than if they didn't have elasticity and significant laxity. Overall, your health is really important in terms of being a good candidate. Being a non-smoker with well-controlled medical conditions is always ideal. It enhances overall the safety and healing of the procedure. And then the third aspect is realistic expectations. You need to understand that success is measured in inches lost and improved body shape rather than just dramatic scale changes. I often tell my patients that The scale is kind of your enemy when it comes to the liposuction journey because your body composition is changing, swelling and volume changes will also be affected in your gross number that you see on the scale. So do not use your scale as a arbitrary number to be looking for. You want to look for inches lost, and the mindset is essential for overall satisfaction. And then let's talk about evidence-based safety. So when I think about my patients, I love to educate my patients about liposuction, overall kind of the safety of it as well. We have large-scale studies in dermatology that show that has favorable safety outcomes in tumescent lipo, which some of you who are attending actually may have already had some liposuction before. Tumescent liposuction was actually invented and created by a dermatologist. It made its way into the aesthetic surgery and plastic surgery world, but it was actually a dermatologist that created and discovered the science behind tumescent lipo. And it's performed under local anesthesia by trained practitioners, and it's one of the safest options to do surgery as an outpatient while you're still awake. The established safety, maximum safety that you can have is about 45 milligrams per kilogram. And what that means is basically we take your weight, we measure your weight in kilograms, and we adjust the absolute maximum of how much lidocaine you can have of tumescent lidocaine, and we will inject that liposuction, that tumescent lipo patient accordingly based on that calculation. This significantly reduces your toxicity risk when it's properly administered in the office. Overall, the significant risk with tumescent liposuction is really rare. Risks obviously increase when you have combined major procedures, which is why it's important to have careful patient selection, and surgical planning is paramount with these procedures. This is the picture of one of the only lasers I could find online. My laser in my office looks a bit different, where it's a large machine that will be wheeled in the OR. But essentially, what I wanted to bring up that the Smartlipo laser is evidence-based. There's many clinical studies that show that laser-assisted liposuction can reduce your blood loss. It can improve your skin tightening and compared to suction alone. And it's also great for those really small to moderate fat deposits that have stubborn fat in those areas with minimal skin laxity. I tend to find that the laser will go ahead and emulsify that fat and add about 10 to 20% success in those areas to have additional fat removal when I go in with the microcannula or pressure-assisted liposuction. So what are some treatment areas that we address when it comes to smart lipo? So the first area is what we often you'll hear kind of a branded term as Smart Lipo 360. And that means it's kind of the core areas around the body. So the abdomen, the flanks, the hips, that's comprehensive torso contouring. Then the second most common will also often be thighs. So inner and outer thigh sculpting to improve your leg proportions. You also will often be seeing that some patients will want their arms or back done. And that's usually upper arms, the bra roll or the bra back. And that kind of creates an enhanced upper body silhouette, almost like a downwards facing triangle. And then the special areas that I often will do, the first one is submental. So patients who have submental fat underneath the chin, we often call it double chin, and then the male chest, so gynecomastia. Those are often adjunct areas. The gynecomastia for men is becoming more and more common, where men have lost a lot of weight, but there's a little bit of a fat pocket just beneath their pec major that needs to be contoured. Now, multi-treatment areas can be planned and staged. I often will recommend that for safety and comfort for you and the overall healing process. It often, we are limited by how much anesthesia we can inject in these procedures. So I often will decide with the patient which ones are the most important or pressing, and we kind of work in stages like that. So what does your procedure day look like if you do decide to go with it? So the first and foremost is your pre-procedure. So we do precise marking, photo mapping to ensure that we get the optimal result and documentation. Then the nurse will come in and you'll have the tumescent phase. So that's when you get local anesthetic infiltration, provides comfort and safety throughout the procedure. Then you go into the sculpting phase, which is the actual liposuction. So I often will use a microcannula for precise contouring. Then I will follow it with laser refinement. Sometimes I'll do laser first with the microcannula. And at my office, we also have PALS, which is pressure-assisted liposuction. And I'll talk about that in a few other slides. But essentially, that's when we use vibration as a way to break up the fat and allow more fat to be removed in those pockets that are a little bit more resistant. And then we've got the completion phase. So the completion phase is where you're going to be sent home with compression garments fitted before your departure. And I often tell my patients walking is encouraged on the same day. It's probably the day when you're going to feel the most tender or sore, and from there on it's upwards. Most procedures, like I mentioned, are performed with patients awake the entire way. You might be given sometimes a prescription sedative just to relax your anti-anxiety medication. That's often a preference for the patient and the provider. And then what do we expect from a recovery standpoint? So the first phase is day 1 and day 3. So you're going to get some soreness. You're going to have, similar to almost like an intense workout, you might have some bruising and some initial swelling, and that's normal and expected. Then you move on to week 1. So week 1, which is the second phase, you can return to desk work, typically day 3 to 7. Some light walking is encouraged to promote healing and circulation. And then my third phase for my patients is usually week 2 to 3. Swelling continues to subside. You can start doing light exercise that you can tolerate with full activity to what you were doing baseline in 3 to 4 weeks under obviously our joint decision. And then month 3 to 6, that's when you start seeing optimal results. So the final swelling starts to resolve. You start getting the true contour, and it only gets more and more impressive by the 6-month mark. And then long-term results, what can you count on? So there's clinical evidence that confirms durable body contouring with weight remains stable. So there's no scientific support for the myth that your fat will move to other areas. That's a common question that I get asked. Well, if I, treat my abdomen and I have fat in my bra back or my lower back or hips or buttock, and it's cost prohibitive for me to do all these areas at once, will I get fat in those areas? And the short answer is no. That's often a myth that's unfortunately propagated online or on social media. It's important to maintain a healthy lifestyle because regular exercise will not only provide cardiovascular and metabolic benefits, but it does continue to support your investment in your body contouring. Now let's talk about some risks, because those are often risks that people will ask about or deter or defer them from actually doing the procedure. So I break it down to common, serious, and rare. So common side effects, so like I mentioned, bruising, swelling, some temporary numbness will happen in those areas that are treated, and some minor contour irregularities. Then serious or rare side effects, which knock on wood have not happened here with myself, at least in my office. So serious infections, seromas, thermal burns from the energy, the laser energy, blood clots, fat emboli, and local anesthetic toxicity. Those are all require immediate attention, and those are often we mitigate those factors by actually screening the right patient to be on it. It's important that we often follow a comprehensive safety protocol, at least in my office. So we will always do, from a range of lidocaine for tumescent lidocaine, we always go on the conservative route, because I would rather you not be in a danger zone when it comes to lidocaine toxicity, and rather be on the conservative dosing. Then you might, when you go online and start searching for procedures, there's a couple options that you'll see, and there's a plethora of information out there. And I want to just kind of break down what the differences are. So there's traditional tumescent liposuction. So that's your, gold standard that we often will do in the office, and that's just, sucking out the fat, reliable with a predictable time-tested contouring results. Then you kind of add on one step more, and that's the smart body, which I talked about. So you've got your enhanced fat removal plus the potential for skin tightening in those very mild lax areas. Then you get into the advanced techniques, which we also have in the office, which is pressure-assisted liposuction, or PALS, that emulsifies the fat. It allows for easier removal, and it's both beneficial to the surgeon and to the patient, because you are allowed to have more fat come out in those areas, because you're able to actually, with minimal damage to the areas, maximize the fat that's coming out in the machine. Then we have those non-invasive options like cryolipolysis, or often we'll see the branded cool sculpting or something similar. These offer no downtime and provide modest changes, but it is unfortunate you need multiple sessions, and they don't often give you skin tightening, which is what often patients want. Now, let's talk about our protocol. So here at my office, we've got 4 certified dermatologists with extensive high-volume body contouring experiences. We use evidence-based protocols and sterile technique. We also, like I mentioned, use patients are awake and they're lightly sedated or have anti-anxiety medications on board. We do meticulous microcannula sculpting throughout the procedure. And then I often will on your pre-op as well as your post-op follow-ups, you'll often get proactive lymphatic suggestions, depending on if you are coming from Austin. If you are from Dallas or Houston, we do have some clinics that we are now starting to work with and recommend. There is recommendations for professional garments to use, and then we'll meet you at those milestones. So day 1, week 1, month 1, and then the 3 to 6 month mark. On my pre-op checklist, which I often will have work with my nurse on, the first and foremost is going to be to kind of highlight your weight stability. So I do recommend patients to maintain a stable weight 2 to 3 months prior to their surgery date. If they do use nicotine or e-cigarettes or vaping, discontinue those completely. Manage your medication, so blood thinners and non-steroidal anti-inflammatories with your PCP to make sure you're in optimal health. And then get a medical clearance. So sometimes we'll do baseline, almost always we'll do baseline blood work, EKG if it's indicated, but typically it's a health and history and risk assessment based on what your past medical history entails. And then logistical planning. So it's always important to have reliable transportation for your procedure day, stock comfortable and compression-friendly clothing for your recovery period, especially if you're driving from afar or flying after. And then recovery, establish a nutritional plan, establish mobility routines for optimal healing, especially first week post-procedure. And then definitely I like my patients to be teed up with some sort of lymphatic massage post-procedure as well. So what does your post-op look like? So your post-op from day 0 to 3 is kind of the foundation phase. So I recommend patients to walk hourly while awake to promote circulation, maintain compression garment, especially I know it's hard during the summer months, but 24/7 for especially for that first 3 days if you can, if not longer. Obviously remove them when you're doing hygiene routines. Week 1 is your progress check. So I often will see these patients back in person if they live local, and that's going to visit and assess their healing. I do recommend light daily activities, and those are usually when patients are getting back to somewhat of a baseline. Then you go into week 2 and 3. So that's your activity. You resume most exercises, your activities gradually. You want to avoid high impact workouts until it's obviously cleared by both of us deciding that this is the right time to go ahead and do those exercises. And then months 1 to 6 are optimization phases. So you want to focus on scar cares, you want to focus on lymphatic drainage support, take your milestone photographies in the office, but also document your own journey as well. It's an investment and you want this to come out the best way possible. So here are some questions that often I get a lot from my patients. So I thought I'd put this almost like an FAQ. So first is, will I lose weight? So my answer is going to be focus on shape transformation and improved clothing fitting rather than scale changes. You'll see inches lost and enhanced body proportions, but I don't want my patients focusing on a number rather than looking in the mirror and seeing how they feel and how many inches they've lost. Another common question is, am I too old for this procedure? So overall, your health status and skin quality matter more than your chronological age. The oldest patient I've done this procedure on is 77, and she was a marathon runner. And so it's one of those things where you, depending on your overall baseline health and your skin elasticity, that's going to determine your individual goals rather than your chronological age. That's another common question is, does it actually tighten skin? And so my answer to that is, like I mentioned, laser assistance can improve mild skin laxity, but significant laxity, and that'll depend on when you do a consult with my consultant or myself at the office, requires both surgical skin removal for optimal results, and that's a different procedure on its own. When it comes to skin to safety, so is it safe to stay awake? And the answer is absolutely. Tumescent local anesthesia has an excellent safety record when performed by experienced professionals in very safe, appropriate settings like we have here in the office. But here's the flip side. When do you recommend waiting? So these are my red flags for patients that I recommend usually waiting as opposed to running into it. So first and foremost, if you've got an uncontrolled medical condition that requires stabilization, it's important to stabilize that condition first. And you can always ask us before any time booking a procedure. If your BMI is significantly above a targeted range, and you'll get your BMI calculated at the office during your pre-op, but if you feel like the BMI is significantly above where you want to be or desired, it's sometimes recommended to go on a weight loss journey, either at the office with us in GLPs or on your own before deciding on body contouring. Unrealistic expectations are always a tricky subject to broach with patients, but I think it's one everyone should reflect on before they go ahead and start their body contouring journey. Severe skin laxity. So if they require surgical excision, that's something that I do recommend patients to be a little bit more mindful of before they start going down this route. Active nicotine use of any kind, so that includes vaping, e-cigarettes, smoking, all of those are not recommended. And then if you don't have adequate aftercare support, that does affect, unfortunately, the outcomes of patients because I feel like they just don't have that emotional support system set up. So I often recommend that should be there. The guidelines are there to protect your safety and overall optimize the final outcome. In my practice, I'd rather delay a treatment than compromise your results or well-being. And then I'm harping on this a lot, but setting realistic expectations is so important. You want to look for smoother body transitions. You want to look for balanced curves. You want to look for natural shadow definitions. And I will show you guys some pictures of my before and afters. Those are what you want to look for. And in terms of your timeline reality, early swelling can mask your initial results, and final outcome photography won't be actually seen until 3 to 6 months to give you the most accurate comparison to your pre-procedure status. So it's important to be patient, but also mindful that there is healing going on post-surgery. In terms of your safety, I think I've already talked about this. I will often, and I will talk about this more in my pre-ops if you decide to book or are interested in booking. But we often do a risk assessment from a clotting standpoint, from a systemic toxicity if you are a candidate, and then often when it comes to volumes of management during the procedure, we're always checking your vitals to make sure your volume status, which is how hydrated you are, is always maintained. So I mentioned the specialized neck area. So the first and foremost, it's becoming a hot topic is chin and neck contouring. So that's usually when you have submental laser assisted liposuction. It's more creating a sharper definition or jawline. And then the other side is arm sculpting. That's also becoming a very common procedure for people to do. And then what does your consultation experience look like? So the first experience is going to be your initial visit with myself or my consultant, Devin, who will follow up with everyone logged in or registered for my webinar. And you're welcome to view this video after as well. Hopefully the team will send it off. But a comprehensive assessment with photography and just goal mapping to visualize your potential transformation. Then we'll often do a candidacy evaluation, so a thorough review of your suitability, our anesthesia options, our target areas, and our realistic timeline of how this works. We're going to create a custom treatment plan for your patients and for my patients, and it's a personalized approach to the specific areas that you are hoping to treat. Decide on if you do want to add the laser inside the Smartlipo or not, and then garment protocols, and then remind you about that recovery calendar. There's always financial transparency at the time of booking, so there's clear pricing breakdowns for you and anyone that's involved in the consult. When it comes to patient satisfaction, it's time and tested that there's a high evidence-based satisfaction for this procedure. People often are so pleased with the results that often will come back for other procedures in other areas, especially if they've gone ahead and done all their weight loss management goals. They've optimized their diet and exercise. I do find that patients will come back to treat other areas if they've were hesitant at first to kind of go all in. They definitely do come back sequentially for other areas as well. And then let's talk about who's a quick candidate. So if you're looking at yourself right now in the mirror and you're listening to the webinar, you're like, am I a candidate for this procedure? So here are the 3 questions that I often will ask every patient to leave asking themselves. So number 1 is what's your weight status? Are you within 10 to 20 pounds of your goal weight, and do you have stable eating habits? Number 2, what are your problem areas? Is your main concern pinchable fat deposits rather than loose sagging skin? And number 3, what is your recovery capacity? Can you take approximately 1 week of modified activity and light duty? And if you've answered a yes to any of those questions, you are an excellent candidate for Smart Body Lipo, and that's where we come in to help support you in creating a personalized treatment plan. And then what do you do to prepare for that, that surgery? So I often will remind patients, optimize your nutrition, establish your protein targets, have an anti-inflammatory diet. Those are all main primary foundation steps to create a great overall experience during your surgery day. Sleep well. It's important for optimal healing as well prior to the surgery, and especially the night before. And what are your lifestyle adjustments? So nicotine cessation, manage your blood thinners, your NSAIDs, any medications that you take regularly with your primary care provider. And then definitely have your support system. Arrange for reliable assistance anywhere from 48 hours to 72 hours post-procedure. And have adequate support just enhances both the comfort and safety during that early recovery phase that I was mentioning. Here are some other questions that I get asked around. This is just more of a lightning round. So number 1 is scarring concerns. So the entry points are about 3 to 4 millimeters, and they're strategically placed kind of in your natural body creases. And that's intentional for my patients because I don't want them to be visible and minimize visibility, period, if I can. Number two, temporary numbness. So a common treated areas, you will have some numbness that typically resolves over weeks as the nerve sensitivity returns. Contour irregularities. So you will get those through the microcannula technique. It's minimized through the cross tunneling technique. So often I will feather the patients with one area and then I will go back over again. That cross, almost like a net-like pattern, will create more of a natural distribution of those fat pockets, and you lose more of an even distribution of fat in those areas, so you actually don't get as many contour irregularities. It's important to also have proper compression as well. With this technique, I find the touch-ups are extremely rare. And then just to reiterate that fat distribution myth, the scientific evidence confirms there's fat does not relocate to other areas, and weight remains stable post when it stays stable post procedure. Why choose our practice or at Westlake Lamar? So we're board certified dermatologists that practice evidence-based protocols. We have extensive body contouring experiences. We have a team set up here for comprehensive support. So if some of you have already had procedures done with us or are interested again, we have a dedicated team. We provide transparent pricing. We have realistic expectations and timelines. We use advanced techniques here. We have PALS or pressure-assisted liposuction. We use assisted precision in our liposuction patients. And ultimately, we have a patient-centered care approach here. So it's comfort first, anesthesia, it's tailored to your individual needs, and overall the experience, I would like to think, is positive from the day you step into your consult with my consultant all the way to post-procedure as well. And then this exclusive offer, every patient or interested candidate that's attending today will get a complimentary candidate assessment from me or my consultant. You will also get event-only booking perks, which will be emailed by Karen, who's our head of marketing here today or tomorrow, I believe, and that's only available to people that have been attending this webinar. Now, what are your next steps to transformation? So what I'd like you guys all to leave with today is identify your goals. Bring your top 1 to 2 target areas to your consultation, and that's going to allow for a focused discussion. And let's have a professional assessment together. We're going to provide comprehensive mapping, detailed planning, and a transparent pricing for your own specific unique situation. And based on how you feel, you're going to be hopefully ready to schedule your appointment and then your future surgery day with us here at Lamar Central. Those are just some references I wanted to put out here for anyone questioning that it was there. Now, here's a little extra that we're going to talk about today, and that's going to be GLPs, because I think that's a hot topic with a lot of my Smartlipo patients or patients who are interested in body contouring. Because I want you to take away with asking, well, why this versus GLP, or why GLP over Smartlipo? And here are some things that I'm going to break down for you guys. So Smart Body Lipo. It allows for a precise shape change in target areas through immediate fat removal with potential skin tightening via the Nd:YAG laser. GLP medications, in contrast, they're a systemic medication. They allow for systemic weight loss. They've got great metabolic benefits for patients who are obese and have diabetes, but it's not designed for spot reduction. So you'll choose liposuction if you've got pinchable fat deposits and you want a silhouette enhancement, and you would choose GLPs if you have overall weight management or cardiovascular risk reduction goals. But it's also important that there's patients now that will benefit from both procedures, and maybe even sequentially. And I'll discuss why that's becoming more of a common question for my patients here at my practice. So let's talk about the efficacy timeline and results. So these are real world scenarios that I see in my practice. So liposuction results, you get visible contour changes immediately with optimal definition emerging anywhere from 3 to 6 months as that swelling resolves. And let's compare the two biggest ones that we often will know. So semaglutide and tirzepatide. So semaglutide, the average is approximately 15% in mean weight loss, but you see that at 68 weeks in clinical trials with a gradual sustained reduction when done correctly. In contrast, tirzepatide or Zepbound, or the compounded variants historically, allowed approximately 20% of mean weight loss at 72 weeks. So that's definitely over a year to 3 years. And adults without diabetes showing superior efficacy when compared to semaglutide. However, it's important to note that when medication was discontinued, there was a significant weight regain, typically occurring within 1 year after stopping either one of those medications, enhancing and emphasizing the need for maintenance strategies. So why does this matter? Because when you think about body composition consideration, there's the concept of global weight loss and targeted fat weight loss. So GLP medication produces whole body fat reduction. But it's also important to note that you get variable effects on your lean muscle mass, which is crucial to maintaining a youthful look. Patients will often comment on facial volume loss, or colloquially, as we say online, Ozempic face. It results from the sudden, often overall weight reduction that doesn't necessarily mean that the medication is not working, but unfortunately, it's a known side effect or bystander effect of this medication. In contrast to this, Smart Body will lipo will remove these localized subcutaneous fat. The laser will give you some modest skin tightening as well. And it's ideal when your weight's already stable, but those specific areas, no matter what you do, are just problematic. And then I'm going to go and take one step further and kind of compare the safety. So tumescent lipo has excellent safety under local anesthesia performed by experienced practitioners here at our office when we use appropriate protocols and staging. In contrast, GLP medications, we know we have got common gastrointestinal side effects like nausea, vomiting, diarrhea, constipation, and now there's evidence, increasing evidence of gallbladder and biliary systemic risks with ongoing monitoring, as well as potential causalities or associations with medullary carcinoma or thyroid cancers. And then it's important to note the perioperative operative considerations. So they are now updated multi-society guidelines that I'm part of as well, that are indicating that most patients can actually continue their GLP-1 before the procedure with modifications, especially if they are high risk. But generally speaking, I've had scenarios where patients have reached their goal weight on a GLP, and now they're ready to tackle those stubborn areas. The considerations and the guidelines now are showing that patients can continue on the medication and they can still get Smart Body at the same time as well. In my experience, the treatment timeline and commitment that I would recommend would be liposuction first. It's a single day procedure. The session usually allows you to go back to desk work within 3 to 7 days, and then full activity within 3 to 4 weeks. In contrast, GLP dosings are weekly or daily, depending on what you're taking. And then they need a gradual titration over months, requiring long-term commitment for that sustained benefit, like the clinical trial showed. There's also a cost and value analysis between the two as well that you're probably thinking about. So the liposuction investment, it's a one-time procedure cost that varies by obviously the treatment areas, but you get a durable shape enhancement that's definitive and long-term when your weight remains stable, and it's still considered the gold standard for when it comes to weight loss. Now you also have GLPs, which are a great investment to some people that want to continue with that weight loss journey, but it is important to note that there's going to be ongoing medication costs plus the medical visits to maintain those that medication on board for you. So who would be a great candidate? This is how I would break it down. Choose Smart Body Lipo if you are at or near your goal weight with mild stubborn fat deposits, some mild skin laxity, and you can benefit from this procedure and you want immediate contour changes. Choose GLPs if your BMI indicates that medical therapy may benefit you and you've got obesity-related health conditions. You might need a more comprehensive metabolic improvements in your blood pressure and your glucose and your weight circumference to even become a candidate for Smart Body. So there's a role that you actually can be considering a combination approach. So many patients will use GLPs to reach their target weight and then add on Smart Lipo for a silhouette refinement. Alternatively, you can also do liposuction first to get a confident boost and then implement GLPs as a long-term maintenance strategy. And here are some common questions that I get in this specific patient population. So can liposuction replace my GLP medication? The short answer is no. Medications treat systemic and metabolic health, systemic weight and metabolic health, while liposuction addresses that localized contouring, but many patients will benefit from both. Which one is safer? So that's a bit of a hard question to answer. Different risk profiles entirely. Liposuction will more be related to procedural risks that are localized and obviously one time. GLPs, it's to be determined. The jury's still out. You have an ongoing medication exposure with systemic benefits, but also potential systemic side effects. Another question I get asked is, will GLP weight loss cause loose skin? And the answer is large weight reductions will definitely reveal existing skin laxity. So if you already had some skin laxity on your lower jowls, which is why I often do Ulthera on those patients, you'll start noticing those a lot more. The same thing goes with the rest of your body. If you've already had skin laxity there, it doesn't affect the tightening of the skin, unfortunately. It'll just make that laxity more obvious. And then the final question I get asked is, can I have liposuction while taking GLP-1s, which I've answered in that previous slide. So usually, yes, following your current anesthesia guidelines, you still can. Most patients will continue the medication. In some scenarios, we have done some recent dose changes or have done the procedure on not the day when they're going to take their medication. So why choose the combined approach? GLP-1 aware protocols. We are aware here at Westlake Dermatology and at Lamar Central with GLP-1s. We prescribe it and see patients often for this medication, but we also will couple that and encourage advanced techniques like the pressure-assisted liposuction and smart body lipo with laser. And overall, the approach that we take here is integrated, and I think that's important to understand that not one option is not better than the other. It's just every patient has an individualized treatment plan that works best for them depending on their medical history. And then I think I've talked to you guys about this ad nauseum now, but I take the contour first approach. So I will ask my patients to consider Smart Body Lipo now for immediate shape enhancement, maintain their fitness, optional medical therapy support with GLP-1s. The other option is your scale first strategy. So do your GLP first, get to your target weight, and then follow with Smart Lipo. And then you can also do a hybrid method, which is do a small area of liposuction during your GLP-1 plateau, which is where you often feel like you've reached your goal weight. There's still stubborn areas, but you just need that extra boost of confidence to continue that weight loss journey. And so here's some patients that I have recently done. So this is a great patient who had Smart Body Lipo 360 with me, phenomenal fitness already, but just had those stubborn areas. And you can see from her body contouring, she had these upper lower abdomen. Her waist flanks were a little bit more stubborn in terms of fat, and she just wanted more lean muscle mass showing. She was not on any GLP-1s, but just wanted some contouring. And this is her after, and you can start to see her abs started showing, and she often comes to me now and she's like, I can just see my abs, and she's so ecstatic with this. You can see down here from her side profile, she started getting definition on not both her anterior lats and her abs, but she also started seeing her obliques a little bit more too, which she was really happy about. Here's another fantastic patient of mine, really nice patient who just wanted some body contouring as well. Great fitness and was already on a great weight loss journey, and in my opinion was already very fit. And he wanted just a little bit more body contouring. He had areas just kind of around the lower abdomen, upper body, kind of the waist flanks area. And as you can see, just some great skin quality, great overall health, and just wanted this to be optimized. And if you look at his after, you start noticing the ab definition, you start noticing the contouring around here, and then you also start seeing kind of the contouring of his abs from the side profile as well. Now, this patient only did Smart Body Lipo of the abdomen, did not do arms or legs or anything like that. Here's another great patient of mine who actually flew in from out of the state to see me, and he was a skin of color patient. These scars are from a childhood surgery, so please ignore those. But you can see here he was on his weight loss journey, had previously been on, very interested in achieving some sort of weight loss medication, but also just wanted some body contouring to boost his confidence. And a very intelligent guy. As you can see, he had significant fat deposits kind of on the hips and waist and flanks area, but also on the upper lower abdomen. Now, if you palpated this, the abdomen, part of it was firm, which meant it was visceral fat, but a lot of it was significantly over the muscle, which would have been great for Smart Body Lipo. Again, great skin quality as well. And this is him just immediately after, I think this was about 2 weeks after. You can already see just complete shrink wrap of the upper lower abdomen. And this was a little bit of swelling that was even going back. That line that you guys could see earlier on, hopefully I can go back. Like you look here, those are almost all gone. And this is just about 2 weeks post-procedure. He was obviously very, very happy with the results, and it was getting continuously better as the swelling and healing was going down. And then finally, here's a lovely patient of mine who was on her weight loss journey, great health as well, great skin quality, and she was just starting to see some excessive resistant and redundant fat on her hips and her abdomen, and she wanted that body contouring in the front and back. She was very, very healthy and wanted to just, help Smart Body Lipo to just be that extra boost in her confidence. And this is her immediately after about 4 weeks after. You can start seeing the contour was brought back into her abdomen and her lower back, as well as her waist, just looked completely shrink wrapped. And that's all I got for you guys. Okay, so I'm going to stop sharing. I've been talking a lot, and then I would love to see if you guys have any questions. You're welcome to ask questions in the chat box, but also feel free to follow up with questions as well. Let's see if we have any questions. Okay, great questions. How long does the procedure take? So that's a great question. Generally speaking, depending on where your areas you were treating, it can be anywhere from maybe a couple of hours when all is said and done. So that includes you walking in the door and leaving the office. You're usually here from anywhere from 2 to 3, maybe 4 hours max. And that includes the tumescent lidocaine administration as well. A great question. And then another question is, how do I know how many areas are recommended, and is that part of the consultation? Yes, so absolutely. Generally what you'll have is if you do a consultation with myself directly, which anyone who's here will get a complimentary consultation with me, or they can see my consultant who will follow up with you all tomorrow, is depending on what we see and what your areas are and your health status is, that's usually what will determine how many areas you should do, or the areas that are recommended. There are certain areas that are often coupled together. So if I am doing the lower abdomen, I do sometimes recommend the upper abdomen. So you get more of a smooth contouring of the abdomen, just like the waist and flanks as well. If we're body contouring and we want patients to just have the hourglass figure or the inverse triangle effect, then I do recommend some areas depending on obviously time, recovery, and budget. And then another question is, when one goes through Smartlipo, are the fat cells permanently, I'm assuming, removed? In other words, if the person gains weight, will fat return to its areas, or will it go to different areas? So that was one of the myths that I was talking to you about, and that's a great question. In terms of Smart Body Lipo, so our fat cells that we have in our body are definitive. So we've got an absolute amount of fat cells, and when you suck those out, those fat cells are gone. What can happen sometimes is the fat cells that are left behind, or the adipocytes, what the medical term for them is, they can balloon, and when they balloon, they can try to fill an area that they have more space for, which is why it's important to always have a weight loss journey and great nutrition, and continue to support your investment in your weight loss journey by working out and making sure you have a healthy diet, because you've done all the hard work now and removed all those fat cells from those areas. You would hate for some resident fat cells that are left behind to start ballooning up and taking up in those areas. Now, generally, I will say those areas that are treated, usually you have the added benefit that you get some adhesion and scar tissue there. So that creates another resistance or difficulty for fat to start coming back there. But that's generally what would happen. And then will it go to different areas? I think I mentioned that in my slides. No, it does not go to different areas. Fat doesn't travel. Good question. If the patient only has a small amount of fat, is she or a good candidate for Smartlipo procedure? Yes. So if you have a small pocket of fat, those are patients that I actually would encourage you to consider doing Smartlipo on, because as you saw in my first patient, she was very healthy, very lean, but those were resistant areas that just became so amenable to the procedure because the microcannula technique will suck out some fat, but then you have the added benefit of using that entry point with the laser and actually causing contraction and tightening of the skin there too, so fat doesn't remain in those low pockets. And then another question is, what recommendation when it comes to air travel post Smartlipo, should it be avoided for a certain amount of time? So I've had patients, travel anywhere from New York, LA, Chicago, North Carolina to come and do a procedure with me. And I generally will say, give yourself the 24 hours. Now, I know we all live busy lives. If you can, you definitely can fly the following day. I don't encourage flying the same day though, just because I'd like to be kind of you have my patients on site or nearby, if they are in discomfort that night or the following day. But generally, most of these patients have all actually, if anything, actually all of them have flown the next day. Some of them have stayed because they've wanted to try to Austin barbecue, so they'll stay from some barbecue and then they'll go a couple days later. But that's about it. Those are all the questions that I see here. Now, if you're too shy or don't want to ask questions, you are always welcome to contact my office. It's Dr. Shahbaz at westlakedermatology.com, or my email is shabazteam@westlakedermatology.com. Devin Wright will be the consultant who will be following up with everyone that's registered, whether you were registered and attended or were unable to attend. You will also getting an email and a follow-up as well. With that, I think I'm going to log off. Thank you everyone for attending, and hopefully this was helpful. And hopefully see you guys in our office at Westlake Lamar Central. My name is Dr. Ali Shabazz. That is our office photo right there too behind me. And I look forward to seeing you guys in person. Have a great night, everyone. Thank you for attending.